few diabetic complications. Diabetic patients, whether they're type 1 or type 2, can have many complications that can involve the eyes, nerves, circulation, kidneys, skin, or both. As a coder, you need to pay close attention to the documentation by your physician, because relationships between diabetes and a complication must be stated. It can never be assumed. Diabetic neuropathy is stated as neuropathy due to diabetes. However, if stated peripheral neuropathy and diabetes, that connection is not clearly stated. Another way it can be stated is neuropathy caused by diabetes, then that would be considered the same. When in doubt, query the physician. Diabetics can have eye and/or kidney problems, but these conditions can also be caused by other diseases. So a senile cataract can simply just be from old age, but if it's stated that the patient has a cataract due to the diabetic neuropathy, that would be different. Another example is kidney disease, because 35% of the time it can be caused by diabetes, 30% of the time by hypertension. Other causes of kidney disease can be injury, blockage of a renal artery, or chronic medication that caused the kidney damage. Whenever a condition is referred to as a manifestation, it would be considered a complication. In ICD-9 coding, your fourth digit is what is going to signify your complication. The code from the 250 classification would be coded first, then followed by the manifestation of the disease caused by the diabetes. Your additional coding instructions include use additional code to specify the manifestation. While the coding in ICD-10 is different, the sequencing rules stay about the same. Here are just a few examples of some of your fourth digit classifications. Then remember, your fifth digit is added by documentation for either type 1 or type 2 and controlled or uncontrolled. You can also use as many of your 250 codes along with their manifestations that you need to identify all the conditions that the patient has. Okay, let's talk a little bit about secondary diabetes. Secondary diabetes can be caused from damage to or removal of the pancreas, from injury or neoplasm, or it can be caused from another disease like cystic fibrosis. It can also be caused from long-term use of medications. One of the common ones would be steroids. In ICD-9, all of your secondary types fall under the category 249. However, in ICD-10, they're broken down into more specific categories of E08, E09, and E13. Gestational diabetes usually occurs during the second or third trimester of pregnancy in patients that are not diabetic prior to them being pregnant. This condition usually resolves after delivery, but can leave the patient at an increased risk of developing type 2 diabetes. Pre-existing diabetes means that the mom was in fact diabetic before she ever became pregnant. In ICD-9, you would look under complications of pregnancy, and it would direct you to the 648 section of your ICD-9 book. Just make sure that you really pay attention to your fourth and fifth digits. In ICD-10, category O as in Oscar 24 has all the codes for both gestational and pre-existing diabetes. ICD-9 and 10 are the same and they're different. ICD-10 has more code sections but does not use the terminology for controlled or uncontrolled diabetes. Just a reminder to always read and study your official coding guidelines for both ICD-9 and ICD-10, and always refer to your coding conventions for your includes and excludes and use additional code notes. Thanks, and I hope you got what you needed out of this. I know that it sounds a little confusing at first, but pay attention and study and you'll get it. Thanks a lot. And keep up the good work.